Good morning. My name is Carol O'Dea and I work with Edenpark Surgery in primary care. It's a GP surgery based in the north side of Dublin. Our partnership is working with people with albinism in Malawi. You might say, why albinism? Because in Europe, the rate of, or the prevalence in Europe is approximately 1 in 18,000. But in sub-Saharan Africa, in some places, it's as high as 1 in 1,000. In parts of, albinism is poorly understood. Historically, PWAs, as I'll call them, have been ostracised as white demons and have had poor access to education, healthcare and employment. They've been the subject of ritual killings and mutilations. Our aim was to develop a partnership that could ultimately roll out a comprehensive programme of care for PWAs, concentrating firstly on skin care prevention. So our initial partnership was with ourselves, Edenpark Surgery, was with the one dermatologist in Malawi, Dr. Maponda, APAM, which is the Association of People with Albinism in Malawi, and we decided to concentrate our efforts initially on one district, Mangochi. An NGO Standing Voice based in London were successfully operating outreach clinics in Tanzania, so we approached them with the view to replicating what they were doing in Malawi. So where are we to date? Well, we've met all the key stakeholders. We've had reciprocal visits. We have delivered 2 rounds of pilot clinics in 3 locations, urban, semi-rural and rural. And we've seen over 170 PWAs who've never before received any education or treatment for their condition. And 10 people have had life-saving surgery to remove actual skin cancers. Well, what have we learned? Well, firstly, there's a desperate need for this project to succeed. 100% of the people who attended our clinics were under 40, and all of them, even the children, had significant skin damage. The average age of the people attending was only 15, so we asked ourselves, well, where are the others? There was very poor knowledge among those who did attend about skin cancer prevention and general knowledge about their condition. Secondly, we learned the importance of in-country context. Malawi was not Tanzania, and we would definitely have to adapt the model going forwards. We have had buy-in from the local district health officer, but further financial commitment is very unlikely in the short term, given budgetary constraints on the ground. We know that we need to broaden our partnership to make more use of available resources, which is something that's come up this morning. Most of the existing care is driven by dermatology officers, not doctors, and local community workers, who we need to involve in the project for it to be sustainable. However, the main thing we've learned is that there's no substitute for time on the ground. We found any project like this is a bit like making a jigsaw. Sometimes people are reluctant to reveal the full picture, worrying that it might preclude them from funding from somebody else. We're very conscious of not replicating projects and of encouraging stakeholders to work together for the greater good. ESTHER has taught us the importance of not just working on the job, i.e. running the clinics, but trying to stand back and look at the broader picture. We recently spent 3 weeks travelling around Malawi, meeting people involved in not just dermatology, but other healthcare projects, and learning from them has been invaluable. But we're also constantly reminded that we're only at the start of a journey on attempting to understand what it's like to live as a person with albinism in Malawi. And as I said, there's no substitute for time on the ground, building those relationships and trust. I'll just leave you with one thing, which was about reciprocal learning, which happened yesterday only. We have set up a WhatsApp group with the dermatology officers, and we are honorary members of this group. And we had a patient yesterday with a Nigerian background who had a skin problem. So we photographed this, put it up, and within 4 minutes we had 20 replies from Malawi, all of which confirmed the diagnosis. So that was a really practical example of reciprocal learning in a very much a primary care setting. So thank you very much, and as I say in Malawi, Zikomo Kwambiri.